It's an honor to be a doctor. It's one of those privileges, and we take it as a privilege. While 40% of the nation's population is minority, less than 7% of physicians are minority. And that's the same percentage as during the Flexner Report of 1910. We have to do something. Something's not happening to get our young people to go into health careers. It's also important when we talk about having the number of health disparities that we have. How many people see someone in a health profession that looks like them? And whether you go to that doctor or that nurse or that pharmacist that looks like you like to know that they exist. And you like to know that it's possible for my child to become a doctor, my child to become a nurse. You know, that's important. We can train our faculty members, we can mentor them. And it takes a lot more mentoring to than just say, okay, I'll mentor you. You have to kind of take them under your wing, let them know that times aren't always easy, but they have someone to support them and someone they can turn to, they can talk to. Everybody goes through tough times, but you know somebody's there, as young people say, to have your back. You need to know that that person is there for you. The environment can be made to be easier. It's tough in medicine, it's tough in health careers, no matter what. But to have someone that you can turn to, talk to, who knows that they'll listen to you and answer your call when you pick up the phone, just knowing they're there really does matter. Prove yourself as a good student. And if you're in medical school and then as a resident, prove yourself as a doctor first. That is so important. That legitimizes everything that you do to make sure you're good at what you do. Your patients deserve the best, and you should be doing the best for them. Even when you're in undergraduate school or taking organic chemistry, do the best you can, because 10 years from now your patient's going to hope that you had it. So do it well and be proud of what you're doing. If it's tough, take it again, but make sure you do your best because your patients deserve that. Also, when you talk about on the floors in the hospital, turn to a unit secretary or whatever and say, have you ever thought about going back to school, or have you ever thought about becoming a nurse or becoming a doctor? Have you ever thought of sometimes just encouraging people because they've never been asked, and just planting that seed and letting them know that if they consider it, you'd be willing to talk to them about it and encourage them. Just give them that spark.